My name is Doug Carlin. I'm an orthopedic hand surgeon and I work at the Carpal Surgery Center. I'm board certified in orthopedic surgery with a certificate of added qualification in hand surgery. Once we have the diagnosis established, I can recommend treatment options. Treatment options can range from postural changes, particularly at night, so that would include wearing a splint at night that keeps the wrist more still. If that's unsuccessful, the next treatment options can include an injection into the carpal tunnel, which is a cortisone injection, which can reduce the swelling around the nerve and potentially give you relief. Once you've crossed the threshold into having persistent or constant symptoms, surgery is the best option to avoid further damage to the nerve. The role of surgery is to relieve the pressure on the nerve to allow the body to heal the nerve and improve your symptoms. The surgery is done as an outpatient procedure. It's a approximately 10-minute long surgery done with mostly local anesthetic and a light sedation with a very low complication rate. There's two ways to do the surgery. I do what's called a mini open carpal tunnel release, which is a small incision here that's often less than 2 centimeters long. I incise the skin. I go down through what's called the subcutaneous tissues to the transverse carpal ligament, which runs this direction. And the transverse carpal ligament is divided in the same line as the skin incision, which allows the carpal tunnel to open up and become larger to reduce the pressure on the nerve. Once that's accomplished, 3 stitches are placed in the skin in this area, and a light bandage is placed from here to here on your hand that stays on for a total of 3 days. Your fingers are free to move to do most household type chores. Writing, typing, feeding yourself is all possible after surgery with very little discomfort. After surgery, you have 3 stitches in the palm of your hand. We send you home with a small light bandage that stays on for 3 days. Your fingers are free to move immediately. Essential tasks such as feeding yourself, writing, typing, putting on clothes are all able to be performed immediately after surgery. There's some mild soreness, but it's not a particularly painful procedure. Typically the surgery is long lasting and we don't see recurrences of carpal tunnel. There's no particular exercises that need to be done after the surgery to prevent it from recurring. The majority of patients can return to work the day following surgery. A typical result following surgery is that the tingling that you feel in your hand, what I call the hot symptoms, the burning type symptoms or tingling type symptoms, resolve immediately. It's a common response after surgery for a patient to come back and say, I should have done this much sooner. The percentage of what a patient would consider a good or an excellent result from carpal tunnel surgery is very high, and most of the literature will quote a success rate of over 90%. It's one of the more successful procedures that we do in orthopedic surgery.